You know, I was gonna do this whole thing where I was walking and gonna talk to you. I see these young influencer. I'm not young, probably not an influencer. However, I wanted to do this thing where, here I am, I'm out walking while my kid's at soccer practice, which I do. I've owned my own private practice for 24 years. However, I think it's really important that you do get your exercise in, you do look after your own health because if for the younger doctors out there, I know what it's like to be so stressed out, you don't have that time for yourself. However, I'm not as good a shape as some of those young influencers or anything. I'm old. I did want to talk a little bit about how independent practices, you hear this narrative all the time that independent practices can't survive anymore. But the reality is, I believe that's not true. Again, this video was supposed to be me walking, but showing you my routine. I'm not built for that. However, I just got done dinner with my family. Everybody's kind of doing their own thing. So I just wanted to take this moment to reach out to you. But here's the truth. I think that independent practice absolutely can survive. You just have to be willing to practice medicine a little differently than I did 20 years ago. In our practice, we focus on technology because I think, things, regenerative medicine treatments, the laser therapy, shockwave therapy, of course, in podiatry, custom orthotics, something I ignored for so many years, which I've talked about before. These things that actually can help patients get better instead of writing another prescription for a medication, sending them out the door. Take the time with your patients because patients are tired too. They're tired of going to these massive systems where the doctors have to see 2 patients every 15 minutes and you're walking out thinking, did anyone actually listen to me? And I feel if you're a patient who happens to come up on this page, you felt that way. When you go to a smaller independent practice, something different happens. You get time, you get attention, and you get a doctor who actually has the freedom to treat you the way they believe is best. So if you're a young doctor watching this, don't believe the narrative that you have to sell out to private equity or join a hospital system. There's still a path to building something great and being independent. And if you're a patient watching this, sometimes the best care you'll ever get is a small practice where the doctor actually knows your name. Anyway, that's my thoughts today. While waiting for my daughter to get done soccer practice, I thought I would put this together. I would be this healthy person doing this whole video. I sold out, came home after, ate dinner, and I figured I'd just do it in my backyard. I think healthcare is changing, but good medicine still matters. As far as insurance companies go, the whole deal with insurance companies, I have many friends who don't even take insurance anymore, but I do believe insurance companies are really the evil ones here. I think insurance companies do try to make a divide between the doctor and the patient. The doctor-patient relationship should be good. So in our office, maybe I see 15 patients in a day, but if I see 15 patients in that time period, it's quality. It's quality patients, not 2 patients every 15 minutes. I have several patients I spend 45 minutes with. They walk out feeling they understand what's wrong with them, and they're on their way to get better. Insurance companies have decreased reimbursement to the extent that, if doctors don't, and I understand in some of these hospital systems, it's very hard for a doctor to be able to spend the time with you. If you're a patient and you're looking at seeing somebody, especially a specialist or a primary care doctor, if you go to somebody who's independent, they're probably going to spend the time with you regardless of what the insurance says. They may offer you things that you won't get in some of those other practices. Anyway, that's my thoughts for the day.